solids are going to sink and the liquid is going to float to the top. Now, between the two, you're going to have what's called the Buffy coat. That's your white blood cells and platelets, and it makes up 1% or less of your blood flow. So we just kind of pretend it doesn't exist. So hematocrit, you would have your percentage of red blood cells and your percentage of plasma, so liquids to solids. Sometimes you'll see hematocrits called packed cell counts because they when they centrifuge. So men are going to be 40 to 54% red blood cells. Women are going to be 37 to 47% red blood cells. So guys are more solid, girls are more liquidy. And again, that's related to if you have more red blood cells, you should have more packed in, which means they're a higher percentage. And this is why you'll see things like guys or people midline. We often talk about guys have more heart attacks than girls, or have higher blood pressure than girls, or more clotting disorders because they have more red blood cells to cause issues. Okay? After menopause, women numbers look like men numbers because they're not having periods anymore. So you can tell the age of the female looking at those numbers. So low, anemic, hemorrhaging, high, polycythemia, dehydration, shock, excessive production. They're related, obviously. Hemoglobin content, this is where you figure out how much hemoglobin you have. So that is activity 5. Picture 29.7 shows you a normal hemoglobinometer. We used to have these. Now we have this newer one. The difference is this one has a little computer that actually looks at the hemoglobin and counts it for you, where this one you actually have to look and count yourself. So this is fancier. But we're still just going to call this a hemoglobinometer, even though it doesn't look like the one in your book. Okay. So what you do, you first have to take your blood sample and you hemolyze it. You break down the red blood cells, releasing all the hemoglobin molecules. And then you put it into your hemoglobinometer and you count the hemoglobin molecules that you have. So men tend to have more hemoglobin because they tend to have more red blood cells. So 14 to 18 grams per 100 milliliters. Females tend to have less, 12 to 16, because they usually have less cells. So low numbers, again, anemic. Now, sometimes you'll get a normal cell count and low hemoglobin content. And that's because you're making the cells, but you're not putting as much hemoglobin into each cell because you don't have enough hemoglobin to distribute properly. So it is possible to be anemic, but still have normal red blood cell counts. If you don't have enough hemoglobin, you can't carry enough oxygen, you're still going to have all the symptoms of anemia. You can have problems with amino acids, which in real life I can spell, but I didn't bother checking. Because again, hemoglobin is a protein. If you don't have amino acids, you can't make proteins. You can't make proteins, you can't make hemoglobin. Vitamin B can be low. So a lot of people misunderstand vitamin B, right? We've all heard things like, oh, B vitamins give you energy, right? Oh, I feel tired. I need to go get a B12 shot. Okay? So B vitamins aren't caffeine. They don't give you energy directly. B vitamins let you make stuff like proteins. B12 is necessary to make hemoglobin. B6 is necessary to process amino acids. So if you have more B12 and more B6, you can make more hemoglobin. And if you have more hemoglobin, you have more oxygen. You have more oxygen, you have more ATP, you have more energy. So you don't take a B12 and go, oh, I feel so much energized now. No. You have B12 today, next week you're going to feel better. Okay? So if someone's like instant, that's psychological. They're like, I feel great. You're like, yeah, of course you do. So they really, really believe in their shots. Most people, it's going to take a while. So you take a B vitamin today, next week you've hit maximum production for your red blood cell counts. So it doesn't give you it. So next time it's like, oh, B12 gives me such energy. You're like, oxygen to make more ATP to have more energy for your cells. B vitamins don't give you energy. They let you do this stuff. So if you don't have enough B vitamins, you'll end up being low on your hemoglobin content. You'll be tired. So even if your cell counts are normal, you still can be tired and suffer the symptoms of anemia because of vitamin deficiency or amino acid deficiency. You could be hemorrhaging. You can have excessive menstrual flow, be a rough week, excessive fluid, all of those at once. Oh, that's horrible. You're a vegetarian on your period, you're going to be so you got to get those. High amounts, again, polycythemia. You can actually have obstructive pulmonary disease. So a lot of people, if they suspect they have COPD, They just don't look at the lungs to identify. They have to do a blood test. So when you have COPD, there's problems getting air to your lungs, whether it's because of emphysema or bronchitis or what have you. And if you can't get the oxygen to your lungs, obviously you can't get to your blood, you can't transport it to your body for energy. So your body will compensate by making more hemoglobin. So you can carry more oxygen even though you're not getting a whole lot of oxygen. So that's why they always do a blood test to confirm if you have COPD other than just looking at your lungs. You'll have people like, I have breathing problems, I cough all the time. They say I have to have a blood test to identify. It's like, yeah, that confirms it. Not only is it affecting your respiratory, but it's affecting your blood system, cardiovascular system as well. Heart failure, congestive heart failure. It'll show up as excessive amounts of hemoglobin production because if your heart is failing as a pump, doesn't pump blood properly, can't deliver oxygen, so we counteract by making more hemoglobin so we can carry more oxygen so we can function better. So if you are suspected of COPD or congestive heart failure, blood tests will confirm if it's to the point the body realizes you have a problem. And then of course living at high altitudes. And this is why so many people live in Florida. Florida has very low altitude, so you naturally have less blood cells, which makes your blood volume a little less, which will lower blood pressure a little bit. Your heart won't have to work as hard. You don't have all these issues. So that's why when you live up in Denver, the old people up there tend to struggle more with breathing problems, tend to struggle more with heart problems and blood pressure problems, because just living there is enough to give you higher blood pressure. Not that I hate Denver, but so those guys. And then coagulation time. So activity 6 talks about coagulation time. So the length of time it takes to take blood into a tube, again, a non-herpetinized clean tube, how long is it going to take to clot? Again, when you do this in a medical setting, they may take a whole blood draw for that. If we were to do it, we would just use a little bit of test tube. And what you would do is you would draw blood into several of those capillary tubes, and then you start snapping because it's going to take so long for it to clot. So at 2 minutes you snap and nothing goes on, you're not clotted. 3 minutes you snap, nothing going on, you're not clotted. At 4 minutes, if you snap and it's like the mozzarella pool on a cheese stick, cheese pool, best part of a cheese stick, right? Hot cheese stick. We've all had cheese sticks. Oh, if you haven't, go get some. You're missing something. Right? But of course, when you pull cheese that's hot, it makes that big string between. You would have that same issue. When you snap, you would have this blood string because it's clotted and it's being pulled apart at that point. And that's when you would know that you have blood clotting. Normal is 3 to 6 minutes. So short amount of time, you're clotting at minute 1. Excessive response, you can have overproduction of clotting factors, you can have really high blood volumes, blood cell volumes, those kind of issues. You might be put on a thinner or something. If you have long time, you may not have enough clotting factors, you may not have enough red blood cells, so anemic people take longer to clot because they don't have as many red blood cells to catch in their little nets of fiber to wall off the clot and so forth. So that one, again, helps with those. So on a quiz, on a practical, I could have a patient and I can say, my patient has blank. Tell me about my patient. And you can tell me if they're a boy or a girl. You can tell me if they're anemic or if they have too much red blood cells or if they have a clotting disorder or they've got a parasite or anything along those lines. So you get to play doctor on the paper. So you'll have to be able to compare and contrast. So you can actually have high, and low and still be anemic, even though you have high numbers of red blood cells. If you got low hemoglobin, you would still be anemic. So you'll need to know these numbers. And there will be something that will give you the obvious, oh, this has got to be a girl versus a guy. So if you have high, low, that's probably a boy. If you have low, high, that's probably a girl. Okay, so we'll give you something to narrow down and make that distinction between girl and boy. I'm not going to go straight in the middle because that's just evil. If they've got 5 million, you're like, well, way to not know. Okay? So I'll give you something that gives the obvious, oh, this has got to be a girl, this has got to be a guy, or a disease of some sort. Okay? Ooh, exciting. Pretend exciting. Yay, I like it. All right, blood typing. So activity 7, as mentioned, we will do synthetic blood typing on Monday. So we have our different groups. In mine, I just have the distinction between Caucasians and African Americans because to me it's easier to learn 2 populations than 3 populations. I'm just lazy. Okay. And that's your biggest split within the population. Asian Americans are usually much lower numbers in percentage of population unless you're so when we look at blood typing, we have antigens. Antigens are genetically determined. Blood group antigens, there's about 50 of them that are out there. So a lot of times if you know you have surgery coming up, you go in early, you do a blood test, they match you as close as they can so they have the right bag of blood on site during your surgery in case it's needed. Now in an emergency situation, you'll usually just fall back on the A, B, and O group and the RH factor because those are the biggest ones that can cause problems for blood transfusions and so forth. So our first group is the A, B, and O group. If you are type O cells are naked. They do not have any antigens on their cell membrane. O is the ancestral state. A and B's are genetic defects or mutations that have become a part of the population. So you have naked cells. So you'll have the majority of people are going to be the O's. So 45% of Caucasians, 49% of African Americans. There are certain populations in the world that are 100% O's. There are pockets in Asia that only have O's. Some of your Native Americans that did not interbreed with white guys are mostly O's. Okay? Because that's what the white guys did, right? Look, this land is now mine, the woman is now mine, all of it mine. Okay, so if you keep your isolated populations, you're not going to mix your DNA. So again, some of them are just straight on O's. A's are the next most common. This was the first mutation to happen way back in the day, and it just keeps going through the generations. 40% of Caucasians, only 27% of African Americans. We suspect that this is a European mutation. Probably happened in Neanderthals and so forth. B group, 11% Caucasians, 20% African Americans. This is an African-based mutation, so it was coming out with everybody in the population. AB, that means you have both an A antigen and a B antigen on the surface of the cell, and that's about 4% across the board. So if you're AB, you're pretty rare. If you're O, you're pretty common with those. So O's have no antigens on their cell membrane. Type A have A antigens, type B have B antigens, and AB have both A and B antigens. Now your RH factors, it's originally called RH because it was found in rufous monkeys and then they found it on people, so they just kept the name. If you are positive, you have the antigen. It's like if you've got COVID, you're positive for COVID. So if you're positive for RH, you're positive for the antigen being present. And this is the normal, this is the ancestral state. It's actually a primate state coming through. So 85% of Caucasians, 95% of African Americans are going to have positive RH. RH negative, your cell would be naked. It wouldn't have any antigen for that. So this is the mutation state. So 15% and 5%. And then the M, N, and MM groups, don't worry, I'm not going to say that out loud on the test. It'll be written for you. M is 20% if you only have the M antigen. N is 30%, just the N. M and N together is 50%. So vast majority have both of these. These little guys are not related to ethnic groups. It's just a straight on human condition if you've got these antigens. So if I was to ask what is the most common type of blood that we would have, that would be O positive MN. What's the most rarest type of blood that we might have? AB negative M. Okay, so you just kind of look at all these together and come up with that statement and so forth. Now, as mentioned, antigens are genetic. They're present at birth. You're always going to have them. They're never going to change. Antibodies are something you make to kill other things, antigens. So antigens or antibodies will not be produced until 2 to 8 months after you're born. So a newborn can actually take anybody's blood. It won't have any kind of transfusion reaction because they don't have a way to fight off anybody else's blood. They don't normally do that because that's just weird. They'll match you. But after 2 months, you'll start having reactions and having health problems. Yes, ma'am?
On the percentages and stuff, we'll have to memorize those as well for like quizzes and everything.
Mm-hmm. Okay. Yep. So I could ask, which of these is most common, which of these would be really hard to find in the population. If I was in a hospital working in this location, what would be more common to appear in my ER, that kind of
Multiple choice, right?
Hmm?
Multiple choice.
thing. You are adorable.
Okay, no, like
On a quiz, maybe multiple choice, but practicals are always fill in the blank. Practical application. Patients don't have options. It'd be nice. And less malpractice if they knew what was going to happen. Okay.
And then the two, at the bottom, the antonyms present at birth, that could be something as well, just anything that's on this page.
Yeah. Anything other than the whole pig saga that we talked about.
Yeah.
But we just know cook our food.
Yeah. I did not say that.
That'll be the one thing you remember in the semester. So that's that second handout. You don't have to print the third one. This is the table that is in your book, but this is the previous edition, so even the previous edition's numbers are different than the current edition's numbers. So you can skip this page, because your lab book has it. This is before we had this lab book, we did it. And this is the hard stuff, so that's next week. So those are the handouts that you'll have for practical one. So these two are the ones you care about for today and the quiz next week. Big bad hair question? Let's play Blood Safari. Are you excited? Woo, Blood Safari. Fine. We're just gonna practice identifying cells. That way you know what they're supposed to look like when you see them on your slides. Now, I did cheat a little bit on these slides. I put it on oil immersion instead of high power, so you could really see their details. Oh, yours aren't gonna look this big. Is that a good darkness? Do you want more darkness? More darkness. I want it dark, look your dark. Close enough. All right, look at that blood. All righty. So again, table 29.1, page 418 is where you're going to be looking to see our reference points. So what are these guys? Red blood cells. You're like, whew, right there. All right. What about these little tiny specks?
Platelets.
Those are platelets. They're little bitty guys because they're littles. Okay. This guy actually has issues. He's a little dehydrated. Look how spiky his cells are. You don't have to know that, but he's got health problems. All right. So our white blood cells. I'm going to show you pretty ones. Okay. So I'm not going to purposely show you crap like that. That's actually an ink stain. That's nothing. Okay. Now on this slide, the only reason I'm showing it to you is because of something fun that we will talk about in lecture. It has these guys. These guys are called bands. These are baby neutrophils. So we're not going to worry about bands for labs, so you can ignore it for this purposes, but we'll mention bands when we get to blood in class. So neutrophils, when they first leave the bone marrow, look like this until they mature enough to go out and kill some stuff and get more lobes to their nucleus. So they're just bands or rods. This is like an 18-year-old, right? 18-year-olds are technically adults, but we really don't expect 18-year-olds to have a career and a family and a home and all that kind of stuff yet. They're just kids still, but legally adults. That's what these guys are. Okay, so we'll talk about them in lecture. There's this little unassuming guy. So what do you guesstimate this is?
Lymphocyte.
Lymphocyte. So things that will help us to identify. One, we have a built-in ruler on all of our slides, right? Red blood cells are 7 to 8 microns in diameter. So you can use a red blood cell to measure everybody around them, okay? So when we look at this guy, he's almost the same size as the red blood cells on either side of him. So he's probably 7 to 8 microns in diameter. And your only white blood cell that is that small is a lymphocyte. So everybody else is way bigger. So that immediately helps you to identify with a lymphocyte, just size alone. Other things that help you, lymphocytes have a huge nucleus that takes up most of the cell. Their cytoplasm sometimes is described as a halo because it's just a very thin slip of cytoplasm. If we do see the cytoplasm, it doesn't have any granules in it. So they are an agranulocyte. Both of the sites, monocytes and lymphocytes, are agranulocytes. They don't have granules or speckles in their cytoplasm. Now with the lymphocyte, huge nucleus, it tends to be a round nucleus, and it may have a little dent in one side, kind of like a belly button, or if you look at an orange, there's like one spot where there's a little navel part, but the rest of it's pretty smooth. So sometimes you'll be able to see the little dent. There's one in here I'll show you that has the dent. But other than that, it's round, and it's the only white blood cell that has a round ball-shaped nucleus. Then we have this guy. So is he bigger or smaller than the red blood cells?
Bigger.
Bigger. Look at this poor guy. He's like, don't touch him. Okay. So big cell, cytoplasm, not grainy. Who's he got to be? He's a monocyte. He's an eater. Monocytes are active phagocytes. They eat all the time, so they're very big cells. These are the ones that leave the bloodstream and become macrophages and microphages that we see in connective tissues. So big boys. He's kind of on the ugly side. He got smushed weird. That's definitely ugly. I'm not going to ask about that one because that was just awkwardly ugly. Woo! So we see our red blood cells. We see our platelets. Honestly, those are the easiest things on the planet. This guy, bigger or same size as the surrounding red blood cells?
Bigger.
Bigger. What shape is his nucleus? U-shaped. Okay, you could even call it a horseshoe if you want to. Who's a big boy with a U-shaped nucleus?
Monocyte.
Monocyte. That's another monocyte out there eating some stuff, right? There's this guy. Bigger or smaller than the guys next to him?
A little bit bigger.
Bigger. What about that nucleus?
It's multi-lobed.
It is multi-lobed. How many do we see there? 1, 2, 3, 4. Who has more than 2 lobes? Neutrophils. Neutrophils are 3 to 5 lobes in their mature. Right? They're the only ones that have more than 2. So we see somebody that looks like a Rorschach test over here. It's gotta be a neutrophil. You're totally gonna be sick of this guy because he's 45 to 75% of the white blood cell count. They're everywhere. All right, that's an ink stain. Don't get excited. Red blood cells, platelets. This dude, lymphocyte. So he's a little bigger than the red blood cell, but again, big round nucleus, little halo. Gotta be a lymphocyte. Now, lymphocytes can be big boys. They can get up to 17 microns. They can be almost the size of sometimes bigger than the monocytes. The trick is, in the blood, most of the lymphocytes are small. The big boys like to live in your lymph nodes, so they don't usually leave the lymphatic system very frequently. So if you see a large lymphocyte, good job. You found a leopard on the safari. So you don't see those very often. So most of the lymphocytes we see are the smaller ones. Okay? But again, they're the only ones that have a big round nucleus. Everybody else has either a bilobed or multilobed. All right. This guy. So this cytoplasm, grainy or not grainy?
Grainy. Not grainy. Wait a minute.
Does it look like it has freckles?
Mm-mm.
No freckles, no
Monocyte.
grains. So non-grainy.
He's a monocyte.
He's a monocyte, thick cytoplasm. The nucleus, again, you can imagine if you squint the view, it would do that. And it's more like this view. So that's a monocyte. That's an ink stain. Don't get excited. And again, red blood cells, little platelets. Oh, another little ugly monocyte. Again, you're getting sick of those two. There's a lot of those out there. Oh, that guy. What's so different about him?
He's red.
He's red. Who's our one white blood cell that comes off as red.
Eosinophil.
Eosinophils, that's going to be the easiest one to see, because he's the only one that's red. He has a bilobed nucleus, sometimes they describe it as B-shaped, but B has two humps. I think it looks like, back in the day when the 7-Up Spot used to wear sunglasses in the commercials. Look it up, kids. The 7-Up Spot used to wear sunglasses, so it looks like the 7-Up Spot with sunglasses on. They're cool. Hey, this guy, that's a neutrophil. He's just kind of shaped. Ooh, that guy. Lymphocyte, little guy, barely see his halo. Must be bad. How about this guy?
Lymphocyte.
This is another lymphocyte. There's his dimple. I told you I had one that had a dent in it. Found him. And again, haloacytoplasm. If we had a monocyte, the cytoplasm is always much thicker, much more evident. Lymphocyte very thin cytoplasm.
Okay.
Oh, this guy,
Lymphocyte.
lymphocyte. Again, you're gonna be sick of this one too, because there's tons of lymphocytes out there. So big round nucleus, halo. How about this smiley guy up here?
Monocyte.
Neutrophil. He got lots of lobes. What about this?
Same.
Yeah, it looks
Neutrophil.
like kidneys and a bladder, but yes, it's a neutrophil. How about this guy?
Lymphocyte.
Lymphocyte. I don't even see his halo.
So that first one was, what is it?
Lymphocyte.
Lymphocyte too.
Oh, look, variety. Finally. This guy.
Eosinophil.
Eosinophil, red with sunglasses. This one that looks like a couple of people on staff.
The puppy, that's a neutrophil.
Neutrophil. Thing on bird of prey.
Neutrophil.
Neutrophil. This guy.
Lymphocyte.
Lymphocyte, little halo. This guy. That is our first base.
First basophil. Okay.
Notice these three are almost the exact same size. All of your fills are almost all exactly the same size. They're like 10 to 12, 10 to 14, 10 to 14. They're almost all the same. Eosinophils and basophils can be slightly bigger than your neutrophils, but notice same kind of size. Now, basophils, they do have a dented nucleus, so it'll tell you it's got that lobed nucleus. The trick is basophils have tons and tons of granules. They have so many granules, you can't see the nucleus usually. It gets obscured. When you look at them under a microscope, they almost look like a mole you need to get checked out for cancer. Okay, so there's just so much kind of lumpity-bumpity within that cell. It's hard to see up there because of the projection angle and so forth, but if you were to see this on the computer screen or the microscope itself, it looks like there's all kinds of little bumps and so forth. If this was a lymphocyte, it'd be like this guy. You would see a halo on that size of a lymphocyte. So since he has no halo and you can't see the nucleus at all, you can't be a lymphocyte. That's a basophil. So look at him next door to his little buddy. They're the same size. So your fills, neutrophil, eosinophil, basophil, are all granulocytes. They've got lots and lots of granules. These are actually lysosomes, little bags of death to go kill stuff. So that's their armor. He's got so many. His lymphocytes are actually filled with histamines and heparin. Histamines are what make your eyes red and itchy and watery, and your skin rash, and your runny nose, and all that kind of stuff. It gives you an allergy. That's going to be this guy. So if you take Benadryl, Benadryl stabilizes basophils, so they can't make things red, itchy, and watery. So that's what they target. Oh my gosh, it's a retina. So now you know what they look like. So on Monday, we'll start off with our simulated blood lab. We'll do a blood typing. And then once we're done with our blood typing, I'll show you the blood game. That's always fun. And then you'll have the rest of the time to look at slides, practice identifying, all that kind of fun jazz, and we'll have the bonus quiz at the end. Big down here, question? Have the most excellent weekend.